Hi, my name is Ezra Steinberg. I'm one of the surgeons here at Maine Veterinary Medical Center. I'm here with JC and I'm here with Ben, and we're going to be talking about maintenance of closed suction drains. Ben here has a closed suction drain coming out of his neck next to an incision, which is right here, and the drain is exiting the skin right here. The drain is connected to a silicone tubing that is then collecting in a bulb right here, which will allow for fluid to come out from underneath the area where he had surgery. Closed suction drains are a way that we can prevent fluid from building up underneath a surgical site. There might have been a tumor there might have been an abscess there, or there might have just been another large vacant area where there was some other tissue. And if you don't remove that fluid, it could build up and get infected. So what you will be doing at home in the immediate postoperative period, you will be emptying this drain several times daily. So closed suction drains come in different sizes. The tubing that is coming out of the skin might have a different diameter to it. It might have a different color to it. And the bulb that is going to collect the fluid might be of different size, but most of them are going to look pretty similar to this one. So we can detach the drain from the harness or the collar that it's adhered to try to have better access for emptying the container. Every drain is going to go home and it's going to have a top on it. It might be a screw cap that's attached to the drain like this, or it might be an injection cap that is separated. What we're going to do, and you should always wear gloves, wash your hands before putting them on, is we're going to empty the drain using a syringe. First, I will open the cap by unscrewing it counterclockwise, and that's going to allow the bulb to lose the negative pressure. So the bulb will enlarge back to its normal size. I will then take out my syringe and screw the syringe to the top right there, turn it upside down, and I can pull back on the plunger to empty the bulb. I'll then remove the syringe. I will estimate, and it's not critical to be exact, about how much fluid has built up. I would say that's about 4 milliliters. I will discard it, and then in order to activate the canister again, I'm going to squeeze it to collapse it completely, and then I will screw the top back on. Once you do that, you want to see that there's negative pressure, that the bulb is completely collapsed, and it's not filling with air. So one thing that we want you to measure at home is how much fluid is building up over the course of the day. And it doesn't have to be exact, but it's nice to take notes and estimate how many times you're emptying it and how much fluid is building up. One major concern would be if you put the top back on after squeezing it to activate it, and then it fills up with air. If that happens, you should unscrew the top again, squeeze it completely, and put the top back on to see what happens. You see how it's collapsed? If it were to fill with air again, that would be an issue.